Okay, so let's start. As in the previous video, we dealt with the anatomy of the liver, the basic anatomy, and the blood supply, as well as the histology part of the liver, which was essential to understand the diseases in a very well manner. Okay, now in this lecture, or from this lecture onwards, we will be dealing with different diseases of what? Different hepatobiliary diseases. Okay, so before starting, the thing is why I started this hepatobiliary diseases after the common git diseases. I hope that you might be knowing it. If you have attended the lecture completely, then you might be knowing why I have started. Because after in this whole gi tract, we know the accessory organs are there: the liver, the gallbladder, the pancreas, isn't it? And there I discussed that this complete tract can have what all diseases, what all possibilities of diseases are there, we have discussed over there. So the intention to take hepatobiliary diseases just after GIT was to complete the whole thing of GIT. Okay, so today we'll be having a discussion on what all are the possibilities of diseases in case of these accessory organs or in case of hepatobiliary diseases. Okay, so let me start it. So, hepatobiliary diseases. Hepato biliary diseases. Now, what all possible diseases are there? See, this hepatobiliary part will have what? It will have a liver, it will have bile ducts, and the gallbladder. These three parts, these three are the basic part of this, isn't it? So, here we can see, let's suppose, okay, this is your liver, and this is the gallbladder and the bile duct. So these three things, one, two, and three, all the diseases coming under this branch we'll be studying in this particular session. Okay, so let's see what all diseases are there. So if I talk about liver, particularly if I talk about liver diseases, what all diseases are possible? So in liver itself, there can be inflammatory diseases, as well as there can be chronic and metabolic diseases. Okay, as well as there can be vascular diseases, and there can be space occupying the lesions, spaces spaces occupying the occupying lesions. Okay, now what all things will come under that? Let's see. So if I talk about liver, what all diseases are possible? Inflammatory, chronic or metabolic, vascular, and space occupying. So if I talk about liver, inflammatory, what all things will come under it? Viral hepatitis. Viral hepatitis. Okay, what are these? What all are it? A, B, C, D, and E, isn't it? A, B, C, D, and E. Now, I accept that. What all will be there? There will be autoimmune hepatitis. Autoimmune hepatitis. What else? Alcoholic hepatitis. What else? It can be any drug or toxic induced hepatitis. Okay, so if I talk about liver and if I talk about inflammatory diseases of liver, what all possibilities are there? There can be hepatitis, different type of hepatitis. What it will be? Viral, autoimmune hepatitis, alcoholic hepatitis, or drug induced hepatitis. So these are the possibilities of diseases in inflammatory liver. Okay, now if I talk about chronic or metabolic diseases of liver, what all things can come? There will be cirrhosis. Okay, what else? There will be non alcoholic fatty liver disease. Non alcoholic fatty liver disease. What else? What else is the possibility? There will be hemochromatosis. Hemochromatosis. What else? Wilson's disease. Don't worry by hearing these terms. We will deal all with all of it. What else? Alpha 1 antitrypsin deficiency. Okay, alpha 1 antitrypsin deficiency. So if I talk about liver disease, and if I talk about the metabolic or chronic liver disease, what all are the possibilities? There can be cirrhosis, non alcohol fatty liver diseases, hemochromatosis, Wilson's diseases, alpha 1 antitrypsin deficiency. Now, let's go further. What about vascular liver diseases? What all possibilities are there? Recently, in the previous lecture, only we saw that. What was it? Chronic venous congestion, isn't it? So, congestive. If I'm talking about vascular, congestive, it will be congestive hepatopathy. In that, what we saw, the right sided heart failure was the reason for various organ congestions, isn't it? Now, the another one will be but Chiari syndrome. Don't worry by hearing these terms. We will discuss it. Okay, but Chiari syndrome. Now, the next part, the last one. If I'm talking about space occupying lesions, what it can be? It can be any liver abscess, it can be any tumor. It can be hemangioma, it can be hepatic adenoma, it can be focal nodular hyperplasia. Anything will come under that. Okay, what else? Metastatic tumor. Okay, metastatic tumor, or else hepatocellular carcinoma can also occur. Okay, so these are the brief of the diseases that are possible in case of liver. Just give me a thumbs up if it's clear. Okay, so you don't have to worry that, oh, what all diseases can happen in liver. This is the nutshell. You can think within this if a patient comes to you. Okay, now next, let's move on to the second part of the hepatobiliary part. What is the second part? It will be either the gallbladder or the bile duct. Let's take the bile duct first. Okay, so what if I talk about bile duct? Explain once again. Okay, just give me a while. I'll okay, I'll explain it once again. So see, what actually happened, what we are discussing over here is we are discussing about the hepatobiliary diseases. Now, what is a hepatobiliary diseases? Here it is. What is hepatobiliary? It is made up of two terms. Hepato, the liver, and biliary is for the bile duct. I hope that this much is clear. What is hepatobiliary? The liver and the bile duct. So and the bile, basically the gallbladder. Okay, so for bile, what two or things are important? The gallbladder, which will store it, and the bile duct, which is going to take it off, and the liver, which is going to form the bile, isn't it? So the diseases which are possible because of these three, we are discussing that only. Okay, so first, what we discussed about the liver. We discussed about all the diseases that are possible in liver. What are they? The inflammatory liver diseases, the chronic or metabolic liver diseases, the vascular liver diseases, the space occupying lesions. What all diseases are possible in inflammatory condition? Anything. Let's suppose a virus came and it gave you an infection, your cells got inflamed, then it will be viral hepatitis. It can be of five types: A, B, C, D, E. Okay, where else it there can be also autoimmune hepatitis, alcoholic hepatitis, or due to any drug or toxin, there can be inflammation in the liver cell. Okay, what else? If we talk about chronic or metabolic liver diseases, there will be cirrhosis, non fatty alcohol liver diseases, hemochromatosis, Wilson's diseases, alpha 1 antitrypsin deficiency. Whereas if I talk about vascular one, then definitely congestion should come to your mind. Okay, the second one, the space occupying lesion. If we talk about the space occupying lesion, you think about the tumors, the benign one, hepatic adenoma, you can think about any liver abscess, you can think about any hepatocellular carcinoma. Okay, now we are moving on towards the second part, that is the bile duct. I hope that the thing is clear. So if I talk about the diseases of duct bile duct disease bile duct disease. Okay, what all diseases will come under bile duct? So the first one, can be cholelithiasis, cholelithiasis, cholecystitis, chololithiasis, that is common bile duct stone, cholangitis, cholangitis, cholangitis. There can be primary sclerosing cholangitis, or there can be primary biliary cholangitis, PBC, or there can be any carcinoma over there. Okay, so don't need to worry what these terms are, because definitely we are going to deal with what is cholelithiasis, what is cholecystitis, what is cholelithiasis, all of that we'll be discussing. Don't worry. What is cholangitis? Okay, don't worry about that. So these are the possibilities of disease of bile duct. Now let's move on to the last part of the hepatobiliary system. Now what it can be? It can be the gallbladder, isn't it? That is the gallbladder. Now what all diseases are possible? Definitely cholelithiasis. Definitely cholelithiasis. And what else? Gallbladder polyps. What else? Gallbladder porcelain gallbladder. What it is, we'll see that. As well as the cholecystitis. So these are the diseases possible in case of gallbladder. So this session, in the beginning of this session, was nothing but introduction of what all diseases are possible in the structures present in hepatobiliary system. Okay, so the in liver, what all diseases are possible, in gallbladder what all diseases are possible, and in bile duct what all diseases are possible. So today we will be dealing with liver cirrhosis. Can anyone tell me what category of disease it is? If I'm talking about liver cirrhosis, then definitely it is a disease affecting liver. But what we know, in liver there was inflammatory, there was chronic, there was vascular and space occupying lesion. What category of this liver cirrhosis will come under? Yes, correct, it is chronic or a metabolic disease. Okay, so we'll deal with that. Let's see, let's learn what is liver cirrhosis. Liver cirrhosis. Okay, so see, liver cirrhosis, what actually happens? The basic thing happens is there will be stiffness of the liver. Okay, we know, if we know the anatomy of liver, we know very well that liver is what? It is a friable organ. It means when you touch, it's soft in nature. It's rubbery in nature. But if a person develops liver cirrhosis, then it won't be anymore a friable or a rubbery element. It will become stiff. Okay, so this is what happens in case of liver cirrhosis. Now, see, let's see the definition. So, liver cirrhosis is a process of liver where that is characterized by fibrosis and conversion of normal liver architecture into structurally abnormal regenerative nodule. Now see, actually this definition has been taken from a standard book. That's why it is so complex. You don't need to worry. See, liver cirrhosis is nothing but a process in which what happens, there is how can you characterize it? By the fibrosis. And what will happen? The normal architecture, it means the normal structure of the liver, will get converted into abnormal regenerative nodule. These two terms are important in liver cirrhosis. That's it. If you understood these two terms, liver cirrhosis is over. What these terms are? Fibrosis and the nodules. Okay, so basically fibrosis happens and the nodules are made, and that's what liver cirrhosis is all about. Okay, so I hope the definition is clear very well. It's very simple. Nothing. What is liver cirrhosis? If someone asks you what is liver cirrhosis, in your brain it should be like the liver will be stiff and there will be fibrosis and nodular formation will be there, because of which the structure of the liver will be changed. That's it. Okay. Now, if we move forward to see what is the cause of this liver cirrhosis. So let's see the cause of the liver cirrhosis. Now, while discussing the basic structure in the hepatocyte, I said you about one cell. What was that cell? The eto cell. The eto cell, what was the function of the eto cell? The function of the eto cell was to store the fat. But whenever there was injury due to any reason, then what I said, what will happen? It will start forming collagen, it will start forming fibers, it will start forming the nodules, isn't it? So that is what happens. So the causes of liver cirrhosis are nothing but it can be alcohol, the major one. Also non-alcohol fatty liver diseases, as well as viral hepatitis. Viral hepatitis can be one of the reason. Autoimmune hepatitis can be one of the reason, as well as the biliary diseases. The biliary diseases can be the reason, or genetic causes can also be one of the reason, or any drug or toxin, as well as heart failure. Now, how all these are acting as a cause, mildly we can understand by the short discussion of the pathophysio of all of it. So let's discuss the pathophysio of these diseases, and during that only you should understand what will be the clinical feature. Okay, by the pathophysio itself we can understand the clinical feature over there. Okay, so see, if I talk about the pathophysio of liver cirrhosis, so very basic what it is. What will happen? Any injury. Now injury doesn't means that someone is going to come and punch. No, not always. It can be any other insult to the cell. What is insult to the cell? If the cell doesn't likes it and you're doing that thing, it said no, I can't bear that much, but still you are continuing to do that. That is what we call insult to the cell. So alcohol, non-alcohol fatty liver diseases, viral hepatitis, either autoimmune hepatitis, biliary diseases, any genetic cause, drug, toxin, or heart failure may do what? Injury to the liver cell. Now, this injury will cause what? It will cause inflammation. Now, of course, the nature of the nature is to balance it. So our cells also know to balance it down. Inflammation is there, they will start working. Inflammation is the sign that they are trying to go back to the normal, isn't it? So definitely the cells will try to go back to the normal. But what if this trauma is continuously given? Then what happens? There will be chronic inflammation. There will be chronic inflammation, and after this chronic inflammation, who came? Who said don't do that? Who said? It was the eto cell. The eto cell will do what? It will get activated, and now this time it is not going to do its normal function, but what it is going to do? It will start producing the collagen. It will start producing the collagen. Because of this, what will happen? The fibrous septa will be formed. Fibrous septa will be formed, and this septa will be encircling the hepatocytes. The hepatocytes will be encircled, and this will lead to the nodules. I'll just show a pictorial diagram. I'll just draw so that you can imagine it well. See, let's suppose this is your eto cell. This one was your eto cell, isn't it? Okay, so this is your eto cell. Now what happened to your eto cell? It got injury. Now it started producing fibers. Okay, it has started producing fibers. It has started producing fibers. Now these fibers will do what? They will start getting arranged. They'll be getting arranged, and the new hepatocytes will be coming under it, and then they will start generating, a- and they will regenerate, and they will form what? Nodules. They will form nodules. And we know that if you have seen any picture of a liver which has been cirrhosed, how it is, it is Let's suppose that if this is the normal liver, the cirrhosed one will be looking like this. Isn't it? You might have seen it. So actually what happens, the nodules are formed. Okay, I hope that it's clear. So this eto cells will form what? They will form the fibers, and then what happens, they encircle the hepatocytes and they generate they are produced, they produce nodules, and then the cirrhosis of liver happens. Okay, I hope that it's clear. Now, after that, what happens? The normal lobular architecture is definitely lost. The second thing is it will be distorting the vascular channels, and there will be hepatocellular dysfunctioning after all of this. Now, why this will happen? Why this will happen? Why this will happen? Let's suppose that this is the cell. Okay, and we know this is your central vein and this is your portal triad, and these are the hepatocytes arranged beautifully. Now what happened? The injury happened, and that hepatocyte, the over here, the eto cells, what they did, they started forming the nodules, and because of that nodules, now the channel has been broken down. Now the channel has been broken down. So now let's suppose this cell will go from here. This that cell, what happened, it went from here. Now you can see very well that once when one cell will go, what will happen, the channel will be broken. Similarly again over here another cell will go. So now you can see how this hepatocyte, soon this hepatocyte will stop working. So what all function was happening over here will no more occur, isn't it? So this is how it happens. Now let's see what are the general clinical features that we can see in case of liver cirrhosis. Okay, what are the clinical features? Let's see that. So the general symptom, let's suppose if a patient comes to you and the patient says, doctor, I feel fatigued always, I'm feeling fatigued, I'm very tired all the time. He says, doctor, I have even lost my weight and I don't feel like any taste in food. The food seems to be tasteless, or I am having weakness. Okay, so these all are sign of liver cirrhosis. Liver cirrhosis. Now, why it is happening? Because definitely the enzymes, liver is producing so many enzymes, so many proteins are produced which are acting as enzymes so that the food can be digested, so that the functions can be taken place properly. That is not happening. Why? Because the hepatocytes are dying. There is death of the hepatocytes. If there is death in a large number, definitely the protein deficiency will be there, the protein will be decreased, the enzyme will not be formed. If the enzyme is not forming, the reaction will stop. So these are the things that the patient, these are the general symptoms that the patient will tell you. What are they? Fatigue, weight loss, anorexia, and weakness. Okay, now another symptoms, these are very interesting one. Let's see what are the other symptoms. Another symptoms can be portal portal hypertension features. Now, what are portal hypertension features? This is what we discussed right now. What was that? Whenever there will be backflow of the blood. Now, why this backflow? Now, over there, when I talk about the backflow, it was because of the right heart failure. Okay, but here it is not due to right heart failure. It is because of the portal resistance. Because of the portal resistance, what happens, there is hypertension because of that, and due to that what will happen, there will be, the blood won't be able to go properly, and what will happen, backflow will happen into different organs such as spleen, it's even into the some region of the gastric part, into the mesenteric part, and what will happen, these organs will seem to be congested, these organs will seem to be getting swollen up. Okay, so this thing will happen. I'll give a quick overview that how it happens. Let's suppose this is the liver. Okay, now this artery is there. Now this will be supplying, this is your stomach, and let's suppose this is your spleen. Okay, spleen is over here. Now we have the vein, portal vein over here. Just give me a while. Yeah. So this portal vein is here. Okay. Now, this portal vein is taking blood from where? Which part? From the a gastric vein is coming over here, a splenic vein is coming over here, a superior mesenteric vein is coming over here, a inferior mesenteric vein is coming over here. Okay, so all the parts of these particular organs are supplying blood to the portal vein, are supplying blood to the portal vein. Now what happened over here in the liver? What was going on in the liver? What was going on? The things were because of these nodules, because the nodules have formed, what is happening? There is resistance, there is resistance, and because of this resistance, what happened? The flow of this blood, instead of up, now because the resistance is there in this portal vein, there is hypertension, and the blood is not able to go in the forward direction, but there are chances of the backflow of the blood, because of which what all organs can be affected? Yes, what all organs? Definitely the spleen over here, definitely the mesenteric part over here, the some part of the gastritis will also be affected. So these are the features of the portal hypertension. So splenomegaly will be there, ascites can be seen, esophageal gastric varices can be seen. Okay, so I hope that that much is clear. Now let's move on forward, and let's see the another clinical feature. Another clinical feature can be hepatocellular failure. Now I guess this is very very easy, isn't it? Hepatocellular failure. Now what is that? What is hepatocellular failure? When the hepatocyte is not able to do its normal function, that's it. So what all can be possible? Jaundice will be there. Can liver cirrhosis cause jaundice? Yes, it can cause. Can it cause coagulopathy? Yes, it can cause. Like I'll give you an example. Let's suppose that you and your friend was playing, and your friend is having liver cirrhosis, and it has reached to and he have got a complication of coagulopathy. You know what will happen? Your friend will get bruises faster. So even if you are going to hit with a very mild force, they will get bruises, and they can tell, oh see, this person has hit me, and they can take you to jail very easily, because they can get bruises very easily. Okay, so the third one is hypoalbumin. Now we know the albumin is so important for the drug binding. So if this is not there, definitely it will affect. The fourth one is hyperammonia. Again, if the ammonia is going to increase, then definitely there are further complications that can be seen, isn't it? Now let's move on to the next clinical feature. What else it is? Endocrine abnormalities. Now this is very very interesting. Now we know either male or female, estrogen is there. Estrogen is there, definitely either it's a male or female. Okay, now this is, let's suppose this is a, okay, this is a person. Okay, he have estrogen over here. Now, when the liver is going to convert this estrogen into testosterone, then only what will happen? This particular person can tell that I am not a girl, but I am a boy. But I am a boy. Okay, then only this person can say that I am not a girl, but I am a boy. Okay, so this estrogen conversion into testosterone is necessary. This estrogen conversion into testosterone is necessary, but liver is not functioning. Liver has altered the steroid hormones over here. Then what will happen? Definitely this poor man can't say that I am a man anymore. What all features can develop? There can be gynecomastia, that there can be testicular atrophy, there can be infertility. But it's not only like it will affect man's, definitely it can also affect the women's. Why? This estrogen, again, is it like we want more and more estrogen only? No, we want it in up to a certain limit. We also want its conversion, right? So what will happen if it doesn't, if this steroid hormones are altered, then definitely there will be menstrual irregularities. There will be amenorrhea. Okay, so this is the condition seen. The next or the last clinical feature of liver cirrhosis is what? Cutaneous cutaneous stigmata. Cutaneous stigmata, nothing but there are three typical terms are there. Just go through it, no need to worry. We it just go through it. It is spider angiomas, palmar erythema. Nothing but the palm will be getting reddish in color. Spider angiomas, that will be structures like that, and clubbing, all of you know. Okay, so these are the clinical features of what? Of liver cirrhosis. And how we are going to do the examination? Definitely all of this thing, whenever wherever we discussed about the clinical features, we said that either first we started with general symptoms, fatigue, by the clinical feature itself we can do the diagnosis. But if we are not sure, we can go for what? Percussion. We can go for what? Auscultation. We can go for palpation, as well as we can do lab test. And what will be the test? Definitely LFT can be done to see. Okay, so this was all about liver cirrhosis. We can, I guess, there is not much time left. I guess if I start jaundice right now, it won't finish, because jaundice is a very good disease. I feel like we can discuss it very beautifully. So we'll be discussing it in the next session. So that's it for today, and we'll be meeting in the next class. Thank you so much for your patient listening.